Welcome, brothers, sisters, working class heroes. This is The Rick Smith Show. Thanks so much for being here today on the big program. Lots to get to, lots to talk about. Another one of those, another one of those days. Stuff you almost can't make up. Evidently, you can plead guilty and then, have the Justice Department throw your case out. Now, look, I understand all along the way you can, until the moment a judge hammers the gavel, you have the ability to rescind your plea. I just don't know how often it happens when the Justice Department steps in and says, you know what, we've decided that we're not gonna bother to pursue a case that we had at one point actually pursued. Now, for those who don't know, Michael Flynn, the general, he and former national security advisor, he pled guilty. He said, yeah, I did it. And then, went on to cooperate with the Mueller investigation and then got a new legal team and then decided, maybe not. Maybe we're going to fight this. Maybe we're going to new attorney general, new opportunity to finagle things. And besides, he had Trump's pardon. And I got to tell you, if I'm Flynn, I think I want the pardon. I do. I think I would have been happy to go plead guilty and then get the pardon. The problem is, and this is a trust issue, I think, I don't think Flynn really believed Trump would pardon him. Just throwing that out there. So he would have gone the guilty route, fell on the sword like the good soldier, and not really, have gotten the pardon. And, for me, I've been looking around all day going, is this a moment? Have there been other moments in Justice Department history where this has happened? Where clearly the guy admitted to the crime, he committed the crime. Is this that moment? Now, everyone's saying, it's because of the recently released FBI memos, the notes in the margin, asking whether, which direction they're going to take with the interview. And having talked with law enforcement people, you go into an interview thinking, which way are you going to take this? If you're just looking for information and you want to catch them up in a lie so that you can build on that, that's one thing. And ultimately you're going to want to, this is how it works. You're going to twist them and put them in the wind and make sure that you get more information because you're going after bigger fish. I got to think that's what they were discussing. But here again, it's one of those moments where, as my grandfather always said, you never put anything in writing because it always comes back to bite you. And when I read it, I don't see it as being bitten by anything. Going into one of those interrogation rooms that they are going to lie, cheat. They're going to do whatever they can do to get you to admit that you did something. Now, here's the thing. Everyone's saying, wow, Flynn is this war hero, all these things. And that's fine. That's great. Yes, he was. We respect his service, all that. But you don't get to break the law. No one is above the law. And as I was reading the responses of people today, people who have spent their career in the Justice Department, the consensus seems to be this is a black day in the Department of Justice's history. This is, a usurpation of law. This is, a moment where the rule of law came in second. And that is a bad thing. So my view on this becomes a campaign issue. I'm calling on Joe Biden to say that, come January 20th, 2021, Flynn will be reindicted. The evidence against him will be presented to a court of law, and he will either be found not guilty or guilty. Because right now the Twitters are going crazy because Flynn was exonerated. No, he wasn't exonerated. He wasn't found not guilty. Simply, Billy Barr and the Department of Justice decided that they were not going to move forward on it. That they were going to pull the case, they were going to drop it, and that was the end of it. And the interesting line in this whole thing that Billy Barr came up with when asked about, he pled guilty, because this is the thing that I think most of us, are kind of looking at going, but he pled guilty. Normally, if you plead guilty, you're guilty, right? Isn't that what most people think? Well, Billy Barr says, people sometimes plead to things that turn out not to be crimes. And you go, really? And I let that sink in for a minute because I do know that people plead guilty to things that they may not have done. They plead guilty to things that may be lesser than what they actually did, or depending on their circumstances, just to save money. They didn't have a lawyer. You can go down the list of the reasons why. Flynn doesn't fit any of that. Flynn had the resources to fight this. He had the President of the United States on his side. He had the entire conservative movement. So when I see this today, this is a black eye on the rule of law. And I keep coming back to, what would have happened had Barack Obama done something like this, had Eric Holder done something like this. The right would have just lost their ever-loving freaking mind. And we can go through all the Fast and Furious and all that stuff. And yeah, there were things that were wrong that happened in every administration. This is the first time someone said, yeah, I'm guilty. And our Department of Justice said, no, don't worry about it. It's okay. It's all right. You're just fine. Anyway, the other big news today, 3.2 million people filed for unemployment insurance last week. That jacks the total up to somewhere in the 34, 35 million range. Personally, and I said this earlier on Twitter, personally, I think I would like to have seen it a little higher. And you go, oh, why? Well, this means more people are not going to work. More people are staying home. Hopefully more people are taking this whole pandemic seriously, and they're collecting unemployment, and they're getting the $600 from the federal government to stay the hell home. Is that hard to get? Is that hard to understand? So I'm not beating Trump up over the unemployment numbers. I haven't. I'm just saying, wow, we're up to 34, 35 million at this point, and it's going to probably get worse. Which is why Trump and the Republicans are so hell bent on let's swing the doors back open. Don't care about any of those problems. Don't care. Just we got to get things back to normal, or some semblance to the old normal. It ain't happening. And again, my fear has been, and I've been very clear on this, is that they rush us into reopening, and as the Federal Emergency Management administration had pointed out, they expect, June to see 200,000 people a day with 3,000 deaths each and every day from this virus. You're seeing the explosion of it. And it could even, who knows, could even get worse than that. And then we end up worse off than we are now. That's my great fear, that all of this was for naught. This was all, well, we held it off for a little bit. And then it came and bit us in the behind because we had failed leadership right from the top. And we now find out, according to a senior CDC official, that the Trump administration is not, they've already said they're not going to follow the Center for Disease Control and Prevention's 17-page set of guidelines for reopening the economy. And look, there's 17 pages is a lot, and there's like a page for how to deal with child care programs. There's a page for how to deal with schools and day camps and that stuff. There's a page for communities of faith, how to reopen churches and do that stuff safely. There's a page for employers with vulnerable workers. There's even one for restaurants and bars, how people can go back to drinking and carousing and eating and all of that, and then one for mass transit. Now understand, those are pages Trump doesn't read, so obviously we're not going to do them. And this is another one of those moments where, Trump is screaming about reopening, but we're not going to, on the federal level anyway, we're not going to move forward in a sane, rational way. That's just not going to happen. Because remember, as I said yesterday, his goal now is to get us to try and forget about it. Forget that people are getting sick, so there won't be any more testing from them. Forget about the fact that people are dying, and they're going to question the death numbers. Everything now is a battle against reality, not against the virus anymore. That's done. They're past that. Now it's a battle of the messenger. Every study that's going to come out, every bit of data that comes out is all going to be called fake news. So Trump and his minions are now going to call all of the stuff that used to be considered scientific research that we have based, pretty much all of our existence on for the last, at least my lifespan. That's all fake news. So the hospital's full of people, the nurses and the doctors who are stressed out and working themselves to the bone to try and save people's lives, all fake news. it's all a hoax. It's all a black flag. It's all a false flag. It's all a false op. They're all crisis actors. You see it coming. So this is one of those moments where be grateful if you live in a state with a Democratic governor. Because I think the Democratic governors, while taking a ton of heat, as our governor here where I live in Pennsylvania has taken a ton of heat, I hope they're gonna be the ones who are a little more sane about this. And then just hope you don't border a crazy state. That's kind of it. Now I look at Michigan. The big news out of Michigan today was Governor Whitmer. She signed an executive order that is extending their stay-at-home order from May 15th all the way out to May 28th. And the reason is she says that they're still in phase 3 of her new 6-point plan. And the 6-point plan, it seems rational. It seems something like the CDC would have put forth that the Trump administration probably didn't read and won't use. But, the idea being you break this pandemic into 6 stages. The first stage being uncontrolled growth. It is just wildfire. You definitely want to lock down everything for that, like China did. China locked everything down. They brought people food to their homes. They brought doctors to their homes. There weren't people walking around on the streets. There was nothing. You were on total lockdown. We could never do that here because our Constitution would never allow it. And we've got too many knuckleheads. That's the other part of it. The phase 2 was a persistent spread, where you're seeing high levels of people contracting the disease. You have a real true concern about the healthcare system being overwhelmed. So you're still going to stay at home there. The third part she points out is the flattening. We're not seeing the big increases. The healthcare system is holding on, and you're getting through the flat period so that you can start down the other side. And that's when she's saying maybe we'll open up a little bit more. The phase 4, and that's the improving phase, where the cases and the hospitalization rates are declining, and clearly declining, where we're not seeing massive numbers of people being sick. And then the 5th stage is containing. That's where the cases and of people getting sick and the death rates are improving. And anytime there's a pocket of outbreak, you're then doing contact tracing. You're then doing isolation. You're dealing. That's, again, smart, which is why the Trump administration is not going to do it. And then the 6th phase is, we're past it. Trump wants to go right from the 2nd stage right to 6. And that's what we're doing. That's what this administration wants to do, and that's where they're going to take us. And this is one of these moments where I go, as a working person, and this is one of those things that you got to wake up to and be aware of. Because look, I've been saying for years, here on the program, we're right on the front lines of the class war. And I've taken flack from people over the years for saying that. Because look, I don't want to be called an essential worker. I don't want to be a frontline hero. The platitudes don't keep me safe. The praise and the pennies don't mean much to me. What means much is coming home at the end of the day and not worrying about being sick. What is important to me is coming home and not infecting my family. That's what I want to know. That's what I want to talk about. And but people go, "Well, Rick, there's no such thing as a class war. You're dividing us." I look at the Wisconsin Supreme Court's Chief Justice, a woman named Patience Rogan-Sack. What Miss Rogan-Sack had to say during oral arguments yesterday, as they were debating the governor's stay-at-home orders, it was pointed out that one of these counties, Brown County, Wisconsin, had seen a massive spike. They saw from 60 cases to like 800 cases in just 2 weeks. In this really short period of time, you saw this massive explosion. And she chimed in, well, these were due to the meatpacking though, right? That's where Brown County got the flare. It wasn't just regular folks in Brown County. And immediately, everyone's asking, well, what do you mean by regular folks? What kind of folks were these who were infected? These 800 people, who were they? And her view was, just those meatpacking. It was just those workers, just those meatpacking workers who then took it home. Understand, they got sick at work. It spread through the plant, and then they took it home to their families, and they went to their churches, and they went to their stores, and they walked down the street, and they got other people sick. This is the reason we need to have safer working conditions. Because if you get it at work, you bring it home, it just doesn't stay at work. You spread this. And a lot of people are saying her remarks are classist and elitist, and they most certainly are. Because we are in a class war. As I said the other day, it's a case of which side are you on? Are you on the side of people like this Supreme Court justice who, it's just those people? Or are you on the side of those people? Those people who, they're just not regular people, not decent people. It's terrible. But again, not surprising, because this is how this is. And look, it's not just here in the U.S. Canada has the same problem. I was reading a story from Canada where the meat packers there are being treated horribly. The grocery store workers are being treated horribly. The nurses are being treated horribly because they're not getting the protective gear that they need. And their unions are fortunately stepping forward and saying, this is an embarrassment. This is flat out wrong. And again, in this moment, we are seeing the power and the voice of unions and the importance. And for me, this is what we need to be talking about. This is where we need to be really, really focusing our attention and really fighting for. So we're going to take a quick break. When we come back, we're going to talk about, there's some organizing going on around nurses. It is Nurse Appreciation Week. Started yesterday, is going to run all the way through till the 12th of May. When we come back, Ben Spate's going to be here from the American Federation of Government Employees to talk about their campaign to organize workers. Quick break. Right back. Stick around. This is The Rick Smith Show.
There's nothing more American than workers standing up, and the union gives a voice to win. On The Rick Smith Show.
I'm Rick Smith, and this is Labor History in 2. On this day in labor history, the year was 1937. That was the day animators struck Fleischer Studios in New York City. It was the industry's first strike. Creators of Popeye the Sailor Man and Betty Boop were fed up with working conditions at Fleischer. They were sick of the long hours, low pay, no paid sick leave, or even vacation time. Some had worked years without a day off. As well, they resented having to ask permission to use the bathroom. Animation workers wanted better working conditions and medical insurance. 2 animators had recently died of tuberculosis, and workers linked their deaths to poor ventilation in the studio. They had been trying to organize with the Commercial Artists and Designers Union for over a year. 2 leading animators were fired for union activity a month earlier, and another 13 were fired when the union approached the studio demanding their reinstatement, union recognition, wage increases, and benefits. In his book, Drawing the Line, Tom Cito writes that picketers were soon marching on Broadway singing, "We're Popeye the Union Man. We'll fight to the finish because we can't live on spinach." One picket sign read, "I make millions laugh, but the real joke is my salary." Strikers received support from the Screen Actors Guild. The Musicians Union refused to provide soundtracks for the studio, and many union projectionists refused to show Fleischer cartoons across the country. The AFL organized a boycott of Paramount Pictures, which financed the studio, and area longshoremen frequently joined the picket lines. After 5 months, the studio finally caved, granting the strikers' demands. But the victory was short-lived. Fleischer made moves to relocate to Florida within a year, in part to bust their union. Labor History in 2 brought to you by the Illinois Labor History Society and The Rick Smith Show. For more information, go to laborhistoryin2.com.
Welcome back to The Rick Smith Show. Now, here is Rick Smith.
So as we've been talking about, it is Nurse Appreciation Week. When we look at and thank those nurses for their service, for their courage, for their knowledge, their experience, their compassion, all of that. And in regular years, it's just a hey, thanks a lot, appreciate it. But right now, in the middle of a global pandemic, it's a lot more than just a thank you. These folks are doing heroic work, walking into situations where it's life and death for them. And sadly, I don't believe we've done enough. And I think we can be doing a lot more. And this is one of those moments, as I've been saying, this is where unions, this is where they do the best work. Being able to stand up and demand better treatment, better conditions. This is where their work is. And we see now VA nurses across the country and healthcare workers have been hitting the streets to raise awareness and talk about the conditions under which they perform the heroic work that they do, and also to demand safer working conditions and more personal protective gear. That's why I've asked Ben Spade to come talk with us. He's the director of AFGE's Crisis Response Campaign. Ben, thanks for taking time for us.
Rick, it's always good to be with you. Good to see you again, even under these circumstances, and talk to your audience about what's going on at the VA.
So walk me through what's going on right now. What are the conditions? What are we pointing out?
Well, the AFG and the National VA Council represents around 250,000 VA workers across the country in large metropolitan areas and rural areas in every state and region of the country. And although the pandemic has had different effects in different parts of the country, there are several things that are arising that are really bringing VA workers together from coast to coast. And that is that the shortages of PPE have been prevalent for way too long, for now going into its the second month. And people have been reporting these shortages just finally this past week due to workers at the VA organizing through AFGE, the National Nurses Union, and others who have been going to the streets and talking to local media and talking to the public about the fact that they're having to wear one mask a day or reuse masks way beyond the protocol that had long been established. So they have successfully won commitments to receive PPE. In some areas have had those resources replenished. The other issues that remain, and not that PPE doesn't, but the other issues that have been raised have been hazard duty pay, paid leave, testing, and the access to telework. And so those have all been issues that have been of top concerns for VA workers who wanted to protect not only their lives and their families' lives, but those of veterans that they serve. So it's been a huge issue. I'm so proud to see people standing up on the front lines of this crisis.
Yeah, and you hit a point there at the end that I think is really important for people to understand. It's just not about keeping the nurses and the healthcare workers safe. It's also about keeping the patients safe. You know, which is why I'm a big proponent at this point of doing as much telework as possible, because there's a lot of things you can do without having to be right there in the room and having that interaction.
Absolutely, and there are untold numbers of people within the VA system. That's both the Veterans Health Administration and the VBA, the benefit side, who have petitioned their employer and who have fought to win telework. What we're concerned with, Rick, you know, I'm based out of here in Atlanta, Georgia, in states that are reopening, where the VA, your public may have read already, your listening audience may have heard that the VA has a fourth mission. Of course, the three main missions of the VA are to provide health care to veterans. The second mission is to provide benefits, and the third mission is to provide funeral services. The fourth mission of the VA is to be the public health care safety net when the private and public healthcare system writ large for the general public becomes overflown or overcrowded and unsustainable. So the VA has already sent staff to state-run veterans hospitals and elsewhere to supplement those staff. But the real concern is that the VA, through and under the Trump administration, has steadily pursued a campaign of privatization that has diminished for many months the staffing levels at the VA across the country, and has coupled that strategy of weakening the VA system, which is the The largest healthcare system in the country is the largest public, obviously the largest public healthcare system in the country. And Rick, it's the largest union contract, federal or public sector union contract in the country, because it covers more workers from coast to coast than any other. The Trump administration under Secretary Robert Wilkie made a strategic move to attack the unions that represent workers at the VA, and has been engaging in a full throttle attack on the right to bargain, and has effectively refused to bargain. And that was all the context that led to the crisis that has happened at the VA. There's no doubt that if VA workers had a seat at the table leading into this crisis, as they had in previous pandemics, the VA system would have been far more prepared. So it's really a tragedy what's happening, but the bright side is that there are VA workers who are going in, serving their communities. Here in Atlanta, we have the Veterans Crisis Line, and those workers successfully won telework over the past few weeks, and they're able to continue to serve veterans who are calling in states of distress and other needs, and able to continue to support them from their homes. And actually they're seeing their productivity levels increase, and they're no longer being forced to work places that they're afraid of being exposed.
Right. When you talk about being the safety net for the whole healthcare system, that's something I don't think anybody's ever really talked about as a mission of the VA. And the fact now that you go back and you realize that, the last time I had the president of AFGE on the program, he said there were something like 50,000 open positions throughout the VA, many of them in healthcare. You look at that deficit. If we would have filled those positions during the last 3.5 years, we may be better off down the road, but we'll never know.
It's really a failure of leadership at the highest levels, and when you have somebody appointed like Robert Wilkie, who's leading the VA, who's completely tone deaf to the reality that's on the ground, the only way to shed light and inform the public is to have frontline workers like we've had in cities like Biloxi, Mississippi, Philadelphia, Pennsylvania. We've had it in Baltimore. We've had actions in West Palm Beach and Bay Pines, Florida. We had actions recently in Houston, Texas. We've had actions in Las Vegas, Nevada. Across the country, VA workers, these are nurses, they're also workers in the administrative positions. They're workers that across the board that are housekeepers that are coming out there, and they're all sharing their common concerns. So, Rick, just as a labor organizer, to take a crisis like this, where people are desperate for change, and to turn that into a movement that I can actually win. So we're gunning for real, tangible policy changes that the VA can implement right now. The VA has the authority on a regional basis to implement hazard pay, which is called retention incentives of 10 to 20% hourly increases for all their workers. They have done that in certain regions of the country. They ought to do that nationwide. They ought to do that not just for nurses, who of course deserve it, but also the housekeepers and others and police officers at the VA who deserve it as well. The other thing that they can do is they could establish paid emergency leave. A lot of folks don't know the Family First Act, the first stimulus bill that was passed and implemented on April 1st, actually allowed VA to exclude its healthcare workforce from the additional 2 weeks of paid leave. A lot of folks don't know that. So all the other federal workers and other workers, have 2 weeks to paid leave, emergency leave. The workers at VA medical centers across this country, workers at VA community living centers and nursing homes, workers at the VA across the country have been denied additional paid leave. So they have had to exhaust already limited paid leave that they've had. And then when they ran out of that paid leave, they have been listed as AWOL, or leave without pay, and face discipline for it. There are unique issues at the VA that we're pushing for, and I think it connects to everything that's happening. I believe in a public healthcare system. The people that are out there fighting every day are providing these services to those that are veterans that have a higher risk, Rick, as people know, because of the the health history and the age of many of our veteran population. And it rips your heart out that it's happening, but also it's also so inspiring to see folks that are stepping up and saying they're going to make a difference. So in these places that they've had these actions, we've seen VA administrators and directors offer more PPE. All of a sudden they had it, they found it. They've offered the incentive, retention incentives, the bonuses for the hazard pay. They have offered new lines of communication with the union. So, Rick, as we talked about in previous times or previous campaigns in the past, collective action gets the goods, and that's what we're trying to encourage people to do.
Yeah, it's amazing what they're willing to give up when you demand it.
All of a sudden, it helps negotiations.
Yeah, all of a sudden they find stuff. It's quite amazing. And you said a moment ago, because I want to highlight one of the points you were talking about additional paid time off and ensuring that that people have that. This isn't just to go on vacation, or this is about mental health more than anything, in my view. Because my fear is, especially with nurses and people in the health industry, is that the stress that they're under, the pressure that they're under, that the daily concern about, am I going to get sick and die, that weighs heavily on you. So the fact that we need to make sure that people get a little time to recharge, get a little time to refocus, I think right now that's so important.
Well, and you're having that coupled with 12-hour days. People are working, knowing that they're leaving their family behind and having to come back home. The time that they would need to feel comfortable just to greet their family again is building into uncompensated time. What we're concerned with too, and that was brought up on a call that we held this evening with VA nurses, was that the states that are reopening, if there's a move to order those that are currently on telework back to work, not only is that a loss to the fact that productivity is increased when people have the adequate technology to do it. And by the way, we taxpayers, Congress has allocated billions of dollars to the VA to outfit all those that are have the skill set and have the capability to do telework with the technology. They can do it from home. And so that's not the issue. So why bring people back to a facility that is going to further expose those that are currently working at the facility and everybody else? So without adequate testing, that simply cannot be done. So AFG is pushing for that return to work process to be done in a way that puts workers at the table to make sure it's done safe.
Good stuff. Let me ask you last line of questioning I've got for you, Ben.
Yes,
and taking this away from simply just the VA and talking about nurses and healthcare workers as a whole, we're seeing a lot of the stresses that we had talked about here a moment ago on them as well. It's not unique to VA nurses or people who are working in the VA to have this kind of stress. The difference is a lot of those nurses in the VA, they've got people like you fighting for them. Sadly, in many communities across this country, the nurses don't. Do you have any advice for those folks? Do you have any direction for people? Because right now, I believe there is going to be a massive explosion of union organizing happening, because I think it's painfully apparent that even with all of the praise, all the platitudes, all of the pennies that they're throwing, it's still you're just a worker. You're negative on the bottom line, and we got to get you to do the job, regardless of what it means to you. So what advice do you give folks?
Well, what I've learned from those that have been on the front lines, Rick, is that people's passion to save and to save lives and to serve their communities and their, those that are veterans and just the general public. As you said, my grandmother was a nurse. She was in the Army Nurses Corps, and she served her entire career as a nurse in Griffin, Georgia, and never was in a union, but she served a textile mill community there. And the people that do this work have a huge heart, and it's that passion for humanity that is compelling them, whether it's the National Nurses Union or as non-union workers, non-union healthcare workers that are confronting those that are at the behest of big business rushing to reopen the states. And they're doing that in a way that's self-organizing, and they're doing that in a way that is motivated by the same passion to serve that brought them into that line of work to begin with. And I think that we as a labor movement, as working people in general, have to go beyond the thank yous, and we have to say if there was a healthcare worker we should follow their lead. They know what they're talking about.
Right.
If I was trying to get my truck fixed, I'm going to listen to a mechanic. If I'm trying to save a public health crisis and save lives, I'm going to listen to those on the front lines.
Absolutely. Ben, I appreciate the time. Keep up the great work. I wish you and your members nothing but the best and safety. Stay safe, and I hope you'll come back and talk to us again.
God bless you, Rick. Thank you so much.
Thanks so much. Our good friend Ben Spade. He's the director of AFGE's Crisis Response Campaign. It's just, it's one of those times where, we've got to pull together. I'd love to hear your thoughts. You can email me, rick@thericksmithshow.com. I'm going to take a quick break. Right back. Stick around.
Remembering that united we bargain, divided we beg. Rick Smith.
I'm Rick Smith, and this is Labor History in 2. On this day in labor history, the year was 1907. That was the day known in the San Francisco labor movement as Bloody Tuesday. In the early 20th century, San Francisco was a city with a strong union movement. In early May, the Carmen's Union called a strike against United Railroads, the company that ran the city's transit system. 1,500 carmen walked off the job, demanding an 8-hour workday and a $3 per day wage. The strike began on a Sunday. The city's transit lines stood silent. The next day, tensions began to mount. The company put up barbed wire around the car barns. Strikers believed this was in preparation to get the streetcars back up and running. Strikers and supporters gathered around the car barns. The day passed with nothing happening. But the next morning, as picketers gathered, 6 cars rolled out of the barns. Hired guns rode with the scab drivers. Angry picketers attempted to stop the streetcars, bombarding them with bricks and stones. Gunfire erupted between the armed company guards and the picketers. 2 picketers were killed in the hail of gunfire. Many more were injured. But this bloody day was not the end of the injuries. It's estimated that 24 people were killed in accidents while scab drivers operated the streetcars. Strikes by public transportation workers were often some of the most contested work actions to take place in big cities. These workers had the ability to impact work sites far beyond their own since they transported laborers to work. The magnitude of a transportation strike would ripple throughout a city, and these strikes were often met with fierce resistance. Labor History in 2 brought to you by the Illinois Labor History Society and The Rick Smith Show. For more information, go to laborhistoryin2.com.
Welcome back to the Rick Smith Show. Now, here is Rick Smith.
So as I said earlier, the number today, another 3.2 million people filed for unemployment. That means another 3.2 million people without a job. That means, again, healthcare at risk for those people. What we've seen now, and this is just, this doesn't happen. I was explaining this to my daughter. Don't hope this never happens again. But you've gone from like a little over 3% unemployment to over 20% unemployment, and somewhere near 34 million people, somewhere in the 34, 35 million people have lost their job in a 6-week period. This is historic. But the thing is there are some groups that are affected at a much, much higher rate. And here to share some thoughts on what he thinks is going on, I've asked Connor Maxwell to come talk with us. Connor is the Senior Policy Analyst for Race and Ethnicity Policy at the Center for American Progress. He's got a piece out right now on workers of color being disproportionately at risk of serious complications from this virus. Connor, thanks for taking time for us.
Hey, Rick, thank you so much for having me on.
So you look at this number, and this number is affecting everyone. But when you dig down a little deeper, it's affecting minorities and people of color at a much, much higher rate. Why is that?
Yeah, absolutely. So people of color in general are contracting coronavirus and dying from the disease at much higher rates for three overarching reasons in general. First is exposure. They're more likely to live in densely populated urban areas, which is a legacy of housing segregation. Second, they're more likely to work frontline, customer-facing jobs or jobs where it's hard to practice social distancing. They're also more likely to be essential workers. So think folks who are working in meatpacking plants or working in hospitals, working as bus drivers, much more likely to come into contact with the virus. The second thing is the existence of pre-existing conditions, higher rates of those. And so that's conditions like asthma, diabetes, heart disease, COPD, that increase the risk of getting very sick if you contract coronavirus.
Right.
And these differences in ailments aren't because of individual behavior or choices, but because people of color in general are much more likely to be exposed to environmental hazards. So, for instance, a lot of municipalities zoned waste sites, factories, polluting industrial sites next to communities of color. So you have higher rates of air pollution. Freeways also going through these communities.
And then poverty, I would think poverty has a huge part to do with this, because I grew up in a housing project on the west side of Cleveland as a kid, and when we first moved there, it was a predominantly white poor area, and it transitioned into a majority black neighborhood, but it was right next to the airport. It was in the crummiest land you could possibly get. So it's basically just poor where poor people are, right?
Yeah, exactly. And people of color are disproportionately poor,
right.
As you know. But municipalities made these zoning decisions decades ago, and they chose to put airports and toxic waste facilities next to these multifamily areas rather than next to communities with single-family units. And so that's why you see some of these higher rates of these existing conditions.
And I would argue also that lower waged workers tend to not have as much access to health care, tend to not have as much opportunity for continual care. So that also puts them, I think, at a greater risk.
Absolutely. And, that's sort of the third driving factor for these differences in mortality that we're seeing around the country. We know that in 2018, 1 in 5 people of color who needed to see a doctor could not due to cost. And, in part that has to do with so many people getting healthcare through their employers, and a lot of poor people and people of color not having access to that care. And so it's, a huge mess all around.
I mean, it's terrible. But, you look at this, and you said a moment ago that, people of color are now being, seen as essential workers, whereas, a couple of months ago, they were just, people that most people looked past. Are you surprised at the level of praise we're now throwing on the lowest wage workers in our society? I guess, are you surprised as I am? Because, it's these moments of crisis that we love to throw praise and maybe a couple of pennies at people, but we don't seem to want to structurally change much.
Yeah, I mean, you're absolutely right. I mean, we're happy to thank essential workers right now. We're happy to thank soldiers, for their service as well. But then when push comes to shove, we're not there to support them when they need it. You have a lot of cashiers at grocery stores right now who are risking their lives on a daily basis, who might have diabetes or a heart condition, who are still making sure that we're all getting our food, but they're making $7.25 an hour, right? It's hard to live off of that.
I argue it's impossible to live off of that. And this, again, is one of those moments where, we haven't even thrown a couple extra pennies at most people. There was a lot of talk of it. There was a lot of talk of maybe we'll get the essential workers, we'll get them some kind of a stipend or some kind of an increase. Hasn't happened. Lots of nice flowery talk. Show me the money and show me when you get it done. Then we'll talk. But we seem to do this all the time. The people that we want to put themselves at risk, the people that we want to go out and die for whatever cause it is, war or now virus. We lots of nice flowery words, but when it's time to put the money where the mouth is, we don't seem to follow up.
No, we definitely don't. I think in general, a lot of politicians think of these communities as expendable. And I don't think it's a coincidence that as the data started to emerge showing who was contracting and dying from this virus at higher rates, there were a lot of governors who almost immediately responded and said, well, we're going to start reopening our economy. We're going to start putting people back to work. And, putting these people in a really difficult situation. And, that's the analysis that we recently completed. We looked at everyone in America who has a pre-existing condition that puts them at risk. It's 28% of people of color. That's more than 20 million workers, 20 million people aged 18 to 64. It's not just seniors. It's not just retirees. These are people who work every single day. And now they're going to have to be forced to make the choice between staying safe from coronavirus and getting a paycheck so that they can make rent and they can put food on the table for their families.
I mean, the numbers are staggering, especially when you break it down to that level. Because look at, as you said, most of the jobs that people of color do. I mean, where I grew up in Cleveland, bus drivers were predominantly black. The people who worked for the RTA, and they're folks who every day were dealing with the public in crowded buses, and they're the ones who are being affected by it, really in staggering numbers right now.
You're completely right. I was born and raised in the District of Columbia, which growing up was a predominantly black city. And I was looking at the data today, actually, on occupation. The most common job held by a white resident of the District of Columbia is a lawyer. Second most common is a management consultant. For black residents, the most common job is a cashier. Second most common is a security guard. And so, you have to think about, what that does in terms of poverty, but also exposure. Who's more likely to be able to work from home to continue to get a paycheck, and who has to go and risk their life on the front line?
And also, it's got to play into, or maybe I put too much into this, but it's got to play into a lot of these governors' decisions to reopen things, especially the ones who want to do it really quickly. I mean, because, I don't know if you saw the story coming out of Wisconsin where the Supreme Court justice says, well, they're just meatpacking workers. It's not like they're regular people.
Right, exactly. You had the lieutenant governor of Texas saying that, he was willing to sacrifice several million seniors in order to save the economy for his grandchildren. What he doesn't realize is that millions of seniors work for a living. If you have millions of American workers dying, that's not so great for the economy. And if half of the population of a meatpacking plant comes down with this thing, that means less meat. That means prices are going to go up. That means that farmers are going to have trouble bringing their goods to market. It's bad for everyone. And so the most important thing is to not reopen prematurely, to make sure that, we continue to practice social distancing until we get a handle on this thing, and then only reopen once we've ensured that we can provide safe working places for all workers, especially those with pre-existing conditions.
Yeah, see, I fear it going just the opposite. I fear, as Trump is now turning his back on this, as they're now trying to walk away from the numbers and all of this stuff, I fear people are going to go back to their normal, what was normal, and we're going to end up seeing what FEMA has said is going to be, what our June is going to look like: 200,000 infections a day, 3,000 people dying every day. And I sadly, and maybe I'm hoping I'm wrong. I'm hoping we're smarter than this. But I have very little faith in we as a population. Individually, I think we get it. But as a population, I fear we're just not very bright. And I fear this explodes over the summer.
I share that fear with you. I think if we continue to practice good social distancing, until this goes away, we'll probably still be hurting economically through the fall. But if we go back prematurely and there's another spike in the middle of the summer, like you're talking about, the economic pain that people are feeling now could last well into next year, if not longer.
But here's my problem. What we've been talking about is exactly why I think you see at capitals across this country a whole bunch of angry Tea Party white folks screaming without their masks and misspelled signs and all of that stuff, because you haven't laid out that it's really going to affect them. It's going to get those old people, and we're going to take out some of those minorities, which for them is a double win because we want to get Granny's inheritance and we won't have to deal with those people anymore, without thinking that it's going to hit them too. The virus isn't looking for just old people and people of color.
Oh, absolutely. I mean, when we looked at the data, it's disproportionately people of color who have these conditions, but 1 in 4 white people between 18 and 64 has one of these pre-existing conditions as well. They're also at risk. I think there's this common misconception that, coronavirus is only dangerous to 1% of the population. There's only a 1% chance that you could get seriously ill from this. But that's just not the case. And especially if we see a big surge, like you were talking about earlier, in cases, and we exceed the capacity of our healthcare system, then you see the percentage of people who die from this ticking up and up and up. Already you have some counties in the United States where it's not 1% of people who get it who are dying, it's 10%. In Randolph County, Georgia, which is a predominantly black county, not great access to healthcare there. Over 15% of people who catch this virus are dying. And so we don't want to see that nationwide. And for those people who are showing up at state capitals saying we need to reopen for the state of the economy, just pause for a second and imagine what the state of the economy would look like if we lost a tenth of our population.
Wow. And you brought up Randolph County, Georgia. Now, I have no idea where Randolph County, Georgia is. And there's no reason why I should have heard about it numerous times over the last couple of years. But isn't Randolph County where they did all of the voter suppression stuff, where they went and they changed all of the voting locations and all of that stuff, all the shenanigans they tried to pull during the last election?
Yeah, exactly. So Randolph County, Georgia is a small county, only about 7,000 residents, if I recollect correctly. And you're absolutely right. It's long been targeted for voter suppression, poll closures countywide to ensure that people don't have access to the ballot box. And so, and Randolph County, like so many counties around the country, have really just been hurting economically in terms of healthcare, education, access to democracy for decades, and continuously exploited. And now they're also paying the price for bad policy decisions from governors like Governor Kemp down there.
Just horrible. So we've kind of laid out the fear, the possibility, the fact that, and there is no denying the fact that people of color are affected by this at a higher rate than the rest of society. What's the answer? I mean, how do we, how do you move forward on this, to protect everyone, but especially the most vulnerable, our seniors, the people of color, the workers on the front lines, the people who are now calling heroes and essential. How do we treat them as such and actually help protect them?
Yeah, it's a terrific question. I think about three things in the short term that we can do to get a handle on this. The first is we really need better testing. I know people talk about this, but they don't talk about it enough. We need more testing. We have a sense nationally and on statewide levels about who's most impacted, but we don't have great capacity down to the county level or the neighborhood level about who needs healthcare resources, who's really suffering the most. And if we don't get that data, these disparities are just going to explode. The second thing that we really need is ongoing economic support for families. As you said earlier, there's more than 30 million people right now who are out of work. People should not have to make that choice between going into work and potentially picking up this thing and bringing that home to their son who has asthma, and making rent. Right?
Yep. No, I'm right there with you, which is from the beginning of this push to getting people back to work. I've been saying Democrats, if Republicans are pushing to force people back to work, the Democrats are going to have to come forth with a piece of legislation to give people real choice on whether they're willing to go back into the workplace. And that is to say, we're doing away with states' requirements that you have to go to work. If you think you choose to stay home and collect unemployment, then you get to stay home and collect unemployment. And if someone wants to choose to go to work and risk that and deal with employers that are going to be shielded from any liability, then that's your choice to do. But give workers an actual choice, because right now, if the employer says, hey, I got work for you, and you don't come, you basically quit your job and you get nothing. So very few of us are going to be able to go very long without any paycheck whatsoever. I think if you're going to force people back into this, you got to give them an option.
Absolutely. I mean, work requirements for public benefits were a bad idea before a pandemic. They're an especially bad idea now. Prior to the coronavirus, less than 15% of all people in places like Georgia and North Carolina were able to get UI benefits, even if they were unemployed. And so, you're creating an even more dangerous situation if they prematurely open and those protections aren't in place.
Yeah, I mean, but here's my problem. I look at this administration, and I don't know if you saw the press secretary yesterday who basically just dismissed any testing because you said testing's the way forward. Her thought was it's all nonsensical. We shouldn't bother with the testing because you're only going to have to test them again in an hour. So it's not we shouldn't do it, which is insane to me. But that seems to be the path that Trump and this administration is going to be going forward on because they don't want to see those 200,000 people a day being infected numbers popping on the headlines.
Yeah, I mean, already we have thousands, if not millions, of Americans who have had and currently have coronavirus who don't have access to tests. And so the problem is much bigger than the data even show right now. And I think the Trump administration has repeatedly demonstrated that they want to keep the positive numbers artificially low so that they can appear that they have a better handle on this thing. But what they're starting to realize, I hope, is that not testing people does not make the problem go away. People will continue to contract the virus. People will continue to die. And so if they want to pause for a second and forget about, the election and Trump's reputation and the narrative at play and actually lead and actually help everyday Americans, they need to ramp up testing.
Yeah, so there'll be no more testing then. If that's the calculus that you just laid out, there'll never be another test had because everything that this guy does, and this is just my view, you don't have to come along. Everything this administration has done has been about politics. It's been about ratings. It's about getting reelected. So the hope that he's actually going to lead for the betterment of the country, for the health of me, I have no faith in that whatsoever at all. And this is why come November, I'm hoping people wake up. But Connor, I appreciate the time. I appreciate the thoughts on this. Good stuff as always.
Thank you so much, Rick. Glad to be on.
Thanks so much. Again, if you want to check out Connor's piece, we'll get links out on how you can see, just what he's talking about. And that, people of color are disproportionately affected by this in the unemployment side and the sickness side. You can email me, rick@thericksmithshow.com. Share that thought with me. Quick break, right back. Stick around. Listen to The Rick Smith Show.
Where working people come to talk.
I'm David Philman, Executive Director of AFSCME Council 13. AFSCME members enforce regulations, keep prisoners behind bars, take care of patients, protect the environment, and more. Chances are you may never see that AFSCME member working in a sewage plant, diving underwater to repair a bridge, inspecting an elevator, or answering a 911 call. But aren't you glad they do? For more information, visit AFSCME13.org.
Welcome back to The Rick Smith Show. Now, here is Rick Smith.
I look at this and what's frustrating, and I feel for these doctors and these nurses and these people who see the ravaging of this disease, how bad it's harming people. In fact, someone sent out an X-ray today of a loved one who had passed away, like a before and after chest X-ray, and it was just wow, it was incredible. The first picture, nice clear lungs, really, and then the next one was just this poor person drowned in their own fluid. I mean, it was what it was. And, I can't imagine what these healthcare professionals are going through, having to be on the front lines of all this, have to deal with all of the stress and all of the pressure and all of the misery and the horribleness of all of this, the death and all of it, only to then, turn on Facebook or Twitter or see these images of these knuckleheads saying it's all a hoax, that it's all made up. And, with something we're going to have to fight. This ridiculous notion that somehow, these are crisis actors and it's not as bad. It's really, and this is because, look, we've actually done a pretty good job. Staying away from each other actually kind of works. But so the better we do, the more successful we are at not dying, the more these crackheads are going to be going on about how it's a hoax and how it's all made up. But you know what? Let them do that. At least people didn't die over it. Gonna take a quick break. Right back. Stick around.
Remembering that united we bargain, divided we beg. Rick Smith.
Here's how I feel about the value of our nation's postal service. The humble post office is a community fixture, a civic inheritance, a rural lifeline, and one of the last vestiges of a shared civic culture in America. Tolerate it, treasure it, and don't let the vicissitudes of global capitalism, contempt for government, or a viral outbreak take it away. Those are my sentiments, but not my words. They're from the American Conservative magazine, calling on people of all political persuasions to save this vital public institution. The men and women of the Postal Service have been steadfast in their duties, especially in times of national emergencies, literally delivering for the American people. In today's terrible pandemic, these workers have kept communication and commerce flowing. No matter who you are, how rich or poor, living in teeming inner cities or isolated rural reaches, postal employees are on the job, so you and I can get our mail, medicines, food, household necessities, election ballots, and other basics brought right to our doors. A stamp is cheap, yet the wear, tear, and costs for the postal workforce can be high. For example, about 1,200 of them have been infected by COVID-19, and at least 44 have died. Yet, the entire public system is now under direct attack by a man-made pestilence called Trumpista vitriolitis that's emanating from the White House. By controlling a $10 billion line of credit that the post office must have to get through the current coronavirus depression, Trump is demanding cuts in the wages, benefits, and rights of our stalwart postal workers, plus authority over hiring top postal officials and the right to raise postal rates. This is Jim Hightower saying, to help stop Trump's power play to become America's postal potentate and privatizer-in-chief, go to the American Postal Workers Union at usmailnotforsale.org.
What do the corporate powers from Wall Street to Walmart have in common? They hate the Hightower Lowdown. You can see why at www.hightowerlowdown.org.
Welcome back to the Rick Smith Show. Now, here is Rick Smith.
So yesterday kicked off Nurses Week, and I'll tell you, as someone who's been, I've been in the hospital a couple of times in my lifetime, and it's always been the nurses who have taken the best care of you. They're the ones who are there all the time, and they always got the best advice. They're the ones who know exactly what's going on. So when a doctor would come in, I would turn to the nurse and go, when he left, that sound about right? And she'd go, yeah, or no, or yeah. I trust nurses so much because they're the folks who are right there all the time. And yesterday, as I said, kicked off Nurses Week. Obviously, the 200th anniversary of the birth of Florence Nightingale on the 12th will end the Nurses Week. But I came across this plan. And it's a grassroots movement of nurses across the state who have come together with Nurses of Pennsylvania and the Nurse Alliance of SEIU to come forward with this idea, this recovery plan for nurses, and to kind of just talk about what's going to help them. And here to share some thoughts on the plan and really talk about what she experiences on a daily basis, I've asked Mimi Waldman to come talk with us. She's a nurse educator, one of our heroes, I do believe. Mimi, thanks for taking time for us.
Oh, Rick, thank you so much for your shout out for nurses and for nursing. I can't tell you how much it means to all of us right now to hear you on our side so strongly the way that you are.
No, nurses are my hero. I had my hip replaced back at the end of January. And when I got back, to my room, the first thing I thanked all the nurses who helped make my recovery much better and much quicker. I love them. They do fantastic work. But right now I'm concerned about them, Mimi. I'm concerned about those people who I admire so much because look, I just don't see our commitment as great as it should be to protecting them.
Well, and rightfully so. I mean, you're hitting the nail on the head. That I think that the plus side certainly is that with this pandemic, with COVID-19, people are seeing nurses in a new light and maybe increasingly thinking of them as the heroes that I believe nurses are. And yet at the same time, given that nursing care is figured in with, if you will, the room and board tab of a hospital, that a nurse is considered to be, in many ways, no different than the bed or the chair in the room, that there is not the value placed on nursing lives the way there needs to be, such that, and this is what, part of the nursing plan is all about, that there needs to be adequate equipment so that nurses can practice nursing safely.
Because nurses, more than anyone, they're right there on the front lines. The doctors, they zip in, they zip out. They're 2 minutes there with a patient. Nurses are there 24/7. I mean, there was a nurse in my room every hour, all day long when I was in the hospital, when I had my hip replaced. And, they're fantastic. Anything I needed, they were right there. Any questions I had, they were spot on. I had a little hiccup in the middle. They caught it. Everything was great. And I'm of the mindset now we've got to do everything possible to ensure that these folks, when they come to work, they are 100% protected, so that when they go home, they are safe and their families are safe.
Right. I mean, as I said, we're simpatico, preaching to the choir, that absolutely, when I participated in the nurse rally yesterday with some of the legislators, that's exactly the idea here, that the analogy that I used is that we would never think of sending our soldiers into battle without weapons with which to fight. And I said, well, we're in a war right now. The war is with, COVID-19, and yet we are sending nurses, first responders into battle without proper protection.
Yeah, and it's disgraceful. It's disgraceful when you look at, some of the photos that came out early of, nurses and healthcare workers in New York having to wear garbage bags as protective gear.
Yep.
Or the stories that have come out of them having to reuse masks for a week at a time, and they're smearing hand sanitizer on the inside of it so that it actually gives some bit of protection. That's disgraceful, and it should have never happened. And it comes from a failure of leadership from the top all the way down.
Absolutely. Absolutely. And that's why, part of the nursing plan is the idea that let us never find ourselves in this situation again.
So let's walk through the plan. And if people want to take a look at it, they can follow along at nursesofpa.org. We'll make sure we get links out so folks can take a look at that. But the plan is, pretty obvious and pretty straightforward. And I think stuff that should have been going on right from the very beginning, which is, we need adequate personal protective equipment. We need the things that keep us safe, not just now, but in the future and always going forward.
Correct. And I want to say that I think a big piece of the puzzle that's missing, as you say, that, these things are pretty straightforward and should always be the case or have been the case, is that the problem is that most oftentimes nurses are not included in the decision-making table, whether that decision-making table is in a legislative kind of way or in the corporate, so to speak, boardrooms of the hospitals.
Right.
Hospitals are too much big business and not enough about care.
See, I've always said we need to have doctors running hospitals. I think I'm going to amend that. I think I would rather have nurses running hospitals instead of bean counters, because they actually understand all of the system and not just the doctor's point of view. So from now on, from this moment forward, I will never say I want doctors running hospitals. I want a team of nurses running hospitals.
Okay, Rick Smith for president. Are we in time? Do we have enough time before November?
I would never stand up to the scrutiny. But that's one of the things that you want in this plan, to have nurses at the table. And I don't think that's too much to ask for, considering it's your behind on the line.
Right. I'll tell you, as we're talking about this, I do want to give a shout out to, speaking of which, a person that to me exemplifies the best of a politician, and that is, and see, I may even goof it up a little bit because I just met her at the virtual rally yesterday, Senator Maria Collette. And I believe, oh boy, and I should have looked this up, but I'm talking right off the top of my head with you. But she actually is someone who was a former attorney who from that decided to become a nurse, and in being a nurse, so took seriously that whole idea of advocacy that both her law and nursing career brought her to, that she then ran for office. And she, to me, when I heard her speak yesterday, you know, to me, she is the best of what politics can have to offer us.
Yeah, I mean,
So
you want people.
I just wanted to salute her.
No, that's fantastic. And we're going to reach out to her now because you brought her up and bring her on the program and talk about this.
Oh, that'd be great.
Because it's that important that we have people who are out in front of this. I mean, too much of what happens is we end up being reactionary. The fact that we are so far behind in this, from the federal level on down, shows me that we didn't have people thinking that this was even a possibility. And yet we've been talking about, a pandemic, going back, to the Reagan years, of possible, diseases coming, and what there were, tons of movies made about it. Does nobody pay attention and plan for this? And that's my problem. We need visionary leadership, not reactionary leadership.
Well, and see, and that's, I think, one of the reasons why you have an appeal to nurses and nursing is because nursing is all about primary prevention. Let's not have a problem. Let's do what is necessary so as to prevent a problem rather than, deal with a problem. Even in terms of, and I have worked with some wonderful, wonderful doctor colleagues, and they themselves will say that it's true when you go to medical school and we talk about our system in the U.S. as being a healthcare system, it really isn't a healthcare system. It's an illness system.
Right. We're reacting.
Exactly.
No, I mean, that's the thing. We have no, which is what the Affordable Care Act was trying to do. Whatever your thoughts on it are, at this point, everybody's got theirs. But one of the things that they were trying to do is get people preventative care, get you used to going to the doctor, getting your yearly checkup, getting your blood done, get those things that help to keep you well instead of going, oh my God, I'm sick right now. Like for instance, I had this conversation today. I'm prone to upper respiratory infections. I've had them for, as long as I can remember. I get one every year religiously right around now. And it's one of those things where, it knocks me down for a couple of days. I know that if I get whatever this is, I get this virus, I'm done because I have lung problems. I have that lung problem that pops up. This is, I'm being proactive. I'm staying the hell away from it.
Good.
If that makes any sense. I mean, and this is where we've got to be proactive.
That makes a lot of sense. That makes a lot of sense.
And this is where we've got to be proactive. And what your plan does, what the Pennsylvania, what the plan does is you also call for widespread rapid testing and contract tracing, as well as paid sick time for those healthcare workers. And that to me is being a little proactive. We're going to find out who's sick. We're going to find out where they are. We're going to separate them. And for those people who are taking care of us, they're going to need a break, because one of the things I've been talking about is I fear that we're going to break you guys. There's a mental health crisis coming, and you can only take so much stress, so much death, so much pain and pressure that you're going to need a break.
Well, that was actually, interestingly enough, one of the points that I made when I was part of the panel yesterday. Your comment about the idea of paid time off, I think, is so very important, and part of the plan also from the perspective that people should not be. And not only nurses, but with the rush now to, reopen the country, people should not be put between a rock and a hard place. In other words, do I have to go into work if I'm sick because I don't have paid time off And so now I need to go into sick so that I can feed my family. And yet by going in to work sick, then I'm exposing other people and on and on. I mean, the whole domino effect that can occur.
Yep. No, you're absolutely right. And it highlights, to bring back something political into this. The Supreme Court justice, the Chief Justice of the Wisconsin Supreme Court, is taking a little bit of heat today for saying that, well, they're not the people who. The county in Wisconsin that went from like 60 cases to 800, it was sparked mainly by a meat processing plant. And,
Right.
She brought up, well, it's not like it's regular folks, highlighting the fact that we don't really care about workers. We're throwing a lot of platitudes at them, a little praise to them. But at the end of the day, there's still this divide. And we have to answer the question, which side of it are we on? Are we the working person who are now being called essential, or the folks who are on the other side of it? And
Right.
to me, that's trouble.
And that's so true. I think that that's one of the things that, likewise, people have not necessarily thought about the gas station attendant, the person who works at the grocery store, those kinds of things, and people that we take for granted in normal times. But, Lord knows what happened with the toilet paper shortage. It's just, people are just not thinking clearly.
No, they're clearly not. And here in the Harrisburg area, we had this, the knucklehead rally a little while ago, and you saw all those people out there with no protection, and not even, in fact, a lot of them think it's a big hoax. Which
Right.
is one of these moments where I go, as a healthcare professional, when you hear someone say something stupid like that, what goes through your mind?
It's really, really rough to know what we know and to see what people are experiencing in the hospitals. And as you mentioned, that we have not only patients dying, we're also dealing with our own friends and or family members, or, a student who I formerly taught, her best friend, her father is, it's not one of those things where you necessarily know someone yourself who has died, which is, I think, part of what contributes to some of the hoax aspect of things. But as time is going on, it's going to increasingly become a situation whereby if you did not necessarily lose someone immediately close to you, you're going to have someone who who you were close to,
Yep.
who has lost somebody.
No,
And
you're
as
absolutely right.
And as this goes on, the circle is going to get, unfortunately, closer and closer to home. And unfortunately, that's one of the things that, human nature is such that people don't always pay attention until it starts knocking at your own door.
And that's my fear for the summer, and which is why I think your list for reopening this nurses plan for Pennsylvania's recovery. And again, if you want to take a look at this, just go to nursesofpa.org. It's right there to take a look at the list. Which is why I think right now talking about this and really working to get this implemented as fast as possible, because I think once we swing the doors open, once they say, okay, we're going to have, I don't think there's going to be a limited move towards swinging the doors open. I think once they crack it open, the knuckleheads are going to smash it open. And we're going to end up, as FEMA has pointed out, with 200,000 people a day getting sick and 3,000 people a day dying. And it just becomes, I fear, overwhelming over the summer.
Well, yesterday at the rally, one of the things I made mention of, and I just had to even stop myself, we have already in the U.S. had more U.S. casualties to COVID-19 than we had during the entire Vietnam conflict.
Yep.
And it's almost to me like we have so become, with the school shootings, it's like we're becoming desensitized even to the death of human beings, that people have just become numbers. It's one thing that we can complain about the bean counters of the hospital, and I'm with you on that, but it's just like we're losing, in some ways, our humanity, and then at the same time, it's during times like this, like back during 9/11, where you see the best of humanity as well.
Yeah, I mean, this is one of those moments, and I fear you're right. When you see politicians who feel emboldened enough to come forth and say, we need to open the economy, if it means, someone dies a little bit sooner, well, so be it. That is just, or the one in California who said, this is how we fix Social Security. Let a bunch of old people die off. It's just mind-blowing to me, and it's mind-blowing that there's an audience that is okay with that.
Right. And unfortunately, that's one of the things actually that Senator Collette was mentioning yesterday in reference to a meeting that she had attended, that I'm frightened by the number of politicians, whether named or unnamed. I remember the guy in Texas. This was about a month and a half ago.
The lieutenant governor, Dan Patrick.
Yeah, when he talked about how he felt that that it was okay for him to say what he was saying, since after all he was 70 or over 70 and a grandfather of how many. And he said, well, hey, if I go, I go. And that's a whole other ball of wax for me, that what has happened that we do not value our elders.
Yeah, and with this again, it comes back to that: which side are you on? Are you on the side of Dan Patrick, who is going to get tested regularly, is going to have access to the best care, is going to be able to have a job that allows him to be away from people if he so chooses? Or are you on the side of that poor bus driver or the truck driver or the nurse or the fast food worker who doesn't have a choice but to go back to that job and potentially put their life in jeopardy for minimum wage or barely better?
Absolutely.
It's crazy.
I'm so thankful that you are raising these issues with your listeners.
No, this is the central issue, because I got a lot of people who are saying, no, we need to reopen, we need to get the economy back, and we could talk about the failures of this administration till the cows come home. But I want to make sure that people get this idea of, if we're going to reopen, we've got to do some things first before we even talk about it. And I think your list is part of that. And I'd like to get back to it, because you say that you need workplace protections for nurses advocating for our patients. Absolutely, unquestioningly. That should happen no matter what the environment is. It shouldn't just be something we talk about in crisis. You also said we need to get people the health care that they need. Mm-hmm. And that's one of those things where, we need to start talking about how we make sure that everyone gets care when they need it, regardless of their zip code or their income or their station in life. That if you're sick, you get to see a doctor. And this is we're in a country where if you get into trouble, I get a lawyer, but if I get sick, I don't get a doctor. It's kind of insane to me.
And you mentioned before the idea that when we talk about people getting the health care that they need, that it also incorporates the mental health care as well as the physical health care.
Yeah. And the last one on your list is we need to make sure that never shall things get this bad again, that we plan, we have some visionary leaders to make sure that we actually have planning in place, and that we have the supplies that we need, that we plan for this stuff and we actually execute it. That seems very sane, very rational. Right.
It seems pretty common sense to me too.
Yeah. So last question I've got for you, because here again, this is a great list, and I hope folks will take a look at it over at nursesofpa.org. It's the nurse plan for Pennsylvania's recovery. We'll get links out on social media how you can take a look at it. What's the last word for folks? What do you want them to know? I'm of the mindset of, look, I've been training my whole life for the couch potato Olympics. I'm staying my behind home. What's the message?
Well, I think that the message, as has been stated by so many people, and that you are reinforcing as well, is to stay safe, stay home, wash your hands, and let's be kind to each other, because together we really can get through this.
Yeah, especially the last one. That's an important one right now. But Mimi, I appreciate the time. I appreciate the work that you guys do.
Thank you.
Thank you so much.
I appreciate you, Rick.
Thank you. I appreciate it. Thanks so much. Mimi Waldman, nurse educator. And again, as I said, if you want to take a look at the list, which I think is really important, nursesofpa.org is where you do that. Quick break, right back. Stick around. This is The Rick Smith Show.
saving work in America, one show at a time. The Rick Smith Show.
I'm Rick Smith, and this is Labor History in 2. On this day in labor history, the year was 1937. That was the day animators struck Fleischer Studios in New York City. It was the industry's first strike. Creators of Popeye the Sailor Man and Betty Boop were fed up with working conditions at Fleischer. They were sick of the long hours, low pay, no paid sick leave, or even vacation time. Some had worked years without a day off. As well, they resented having to ask permission to use the bathroom. Animation workers wanted better working conditions and medical insurance. 2 animators had recently died of tuberculosis, and workers linked their deaths to poor ventilation in the studio. They had been trying to organize with the Commercial Artists and Designers Union for over a year. 2 leading animators were fired for union activity a month earlier, and another 13 were fired when the union approached the studio demanding their reinstatement, union recognition, wage increases, and benefits. In his book, Drawing the Line, Tom Cito writes that picketers were soon marching on Broadway singing, "We're Popeye the Union Man. We'll fight to the finish because we can't live on spinach." One picket sign read, "I make millions laugh, but the real joke is my salary." Strikers received support from the Screen Actors Guild. The Musicians Union refused to provide soundtracks for the studio, and many union projectionists refused to show Fleischer cartoons across the country. The AFL organized a boycott of Paramount Pictures, which financed the studio, and area longshoremen frequently joined the picket lines. After 5 months, the studio finally caved, granting the strikers' demands. But the victory was short-lived. Fleischer made moves to relocate to Florida within a year, in part to bust their union. Labor History in 2 brought to you by the Illinois Labor History Society and The Rick Smith Show. For more information, go to laborhistoryin2.com.
Welcome back to The Rick Smith Show. Now, here is Rick Smith.
So like I said, I'm looking at this image that someone sent me of a chest x-ray. And, I'm going, personally, I'm in good health. I don't have any long-term chronic conditions. I have none of that stuff, knock on something. I don't have to go to the doctors for stuff, but I do get this upper respiratory infection every year religiously. And it's one of those things where, a couple of times over the years, I've had to go get antibiotics. That's gotten that bad. But you know how it is. You go through the cycle of colors and of what keeps coming out. Not to be gross or nasty. But, it's one of those things where sometimes it gets really bad. And, as I was saying, I know that I'm susceptible to that kind of an illness. So if I get this, I know I'm going to have that chest x-ray. I know that'll be mine, and it'll be something that my wife will be posting. Yeah, he's gone. Here's what it looks like. And I don't want that for myself, clearly, but I don't want it for anyone else either. And this is just one of those weird moments where we as a society, we've got to make some choices. And talking to Mimi there, it's amazing to me that we haven't already implemented the common sense kind of things that they are now, months into this, saying that we should be thinking about moving forward on. I mean, that's the part that gets me. I mean, we should already be well down the road to putting this stuff in place and ensuring that our frontline workers are cared for. We're getting there, but way late. And, I point to the story we had last week of the Teamster leader from Washington State who said, look, the meat processing plant that we work in, the first case hit, we went, shut things down, worked with management to shut things down, sent the workers home, got them paid, got them to shelter in place, cleaned the place top to bottom, sanitized, and they're running up and running fine. They've had a handful of cases, and they've dealt with it. They've brought in separate trailers for lunchrooms. They've staggered start times. They were really proactive. And the reason that they were doing that is because the workers had a say in how things should run. The workers were saying, hey, this is the best way to protect us. This is the best way to help us stay safe. Now, as that guy pointed out, just 15 miles down the road, you got the other processing plant, which is still, I guess, closed down now, right? Where half of the workforce was infected, and you had people die because, well, they had no voice. They had no ability to have any say in their working conditions. And this is another one of these moments where I keep coming back to, if we had labor density in this country in the 20-25% range, or 35% like we had back in the 60s, workplaces would be a hell of a lot safer. But the sad reality is we don't. In the private sector, it's about a little over 6%. So those 6% of workers, they're having their say. They're protecting themselves as they can. It's everybody else who's in this desperation moment. And I keep saying, out of this, I'm hoping that everyone who had to go to work and had to do something that made them feel uncomfortable or unsafe, I'm hoping you go, you know what? No more of this. I'm hoping you'll go, we need to join and form unions. We need to come together and we need to bargain. Because all it really is a relationship, a partnership with the employer. As opposed to right now where it's still master and servant. You're at the will of that employer. And we now see, 35 million people who were just thrown out of their jobs? The push here with the CARES Act was to keep people on the payroll. The push here was to keep them on the payroll and keep paying them, keep their benefits going, and then being reimbursed by the federal government. That didn't happen. That didn't happen for 35 million people. So that means that, probably the end of the month, you're going to see more people uninsured. And we don't have a safety net for those folks to really get the insurance that they need. So what do you have? You have trouble. You have chaos. So I look at this list by the nurses, and this is the minimum that we should be doing for society, not just for nurses. A seat at the table is a minimum in my view at this point. Enough adequate protection is a minimum. But will we get there? Will we demand it? Especially when you've got these knuckleheads who are running around saying it's all a hoax and reopen things. It's crazy times. Crazy times. Love to hear your thoughts. You can email me, rick@thericksmithshow.com. I'm going to take a quick break. When we come back, Dr. Kelly Senholz is going to be here to share some thoughts on where the numbers are, what things look like, and, what we can expect over the coming weeks. Stick around. Right back.
Waving the flag of freedom for people, not corporations. Rick Smith.
Even if we completely stop emitting greenhouse gases today, we will continue to feel the effects of a warmer world.
Man-made global warming will render some regions unlivable within 50 years, new study warns. Siberian forest burning at rates not seen in 10,000 years.
Who saw it 10,000 years ago?
Plus,
it looks like something out of a horror film with a name to match.
Murder hornets. Yes, murder hornets. Giant invasive bee-killing hornets confirmed in the United States.
All of those stories and more straight ahead from BradBlog.com. I'm Brad Friedman.
And I'm Desi Doyen.
Stand by for 6 minutes of independent green news, politics, analysis, and snarky comment.
These hornets grow up to 2 inches long, roughly 5 times the size of a bee.
The mandibles, they're very, very sharp. And that's what they use to decapitate bees. And then they'll mash up the thorax into a meatball, they call it, and fly it back to feed to their larvae.
What the actual?
Couldn't have said it better myself. This is your Green News Report. Okay, Desi Doyen. I think at this point, Mother Nature is just trying to tell us to get the hell out of here or something. I mean, this is insane. Murder hornets, really?
Yes, a global pandemic, a plague of locusts. If you didn't have murder hornets on your apocalypse bingo card, you can be excused.
I guess.
It's a giant invasive species of hornet from Asia, nicknamed murder hornets. It has somehow arrived in the United States.
Great.
With 4 confirmed sightings in Washington state.
These hornets grow up to 2 inches long, roughly 5 times the size of a bee. And in Japan, where they originate, they reportedly kill up to 50 people each year. They're giant stingers capable of piercing a beekeeper's suit.
While its sting is dangerous for beekeepers, it is a much bigger threat to honeybees that are crucial to the U.S. food supply. Just a few hornets can slaughter an entire honeybee hive in just hours. Populations of U.S. honeybees have already declined by more than 40% over recent years due to colony collapse disorder, which is linked to pesticides. Bee experts say it is imperative to eradicate this invasive hornet before it spreads to the rest of the continent, because honeybees pollinate more than 90 vital food crops.
I swear to God, if the murder hornets are responsible for my tomatoes not fruiting so far this year, I'm going to murder those hornets.
Okay. Some big climate news. The European Union's climate monitoring service Copernicus announced that April 2020 is tied with 2016 for the hottest April ever recorded globally since record-keeping began in the 1880s. NASA and NOAA are likely to announce similar conclusions in coming weeks. The new record hot April means 2020 is almost guaranteed to be one of the top 2 hottest years ever recorded.
Yeah, whatever. We've got murder hornets now.
That heat, however, has consequences in Siberia. The boreal forest is already burning at a rate not seen in 10,000 years, with more than 5 million acres ablaze, and it's not even summer yet. The fires are releasing even more climate-warming CO2, in turn triggering more heat and triggering more fires. In the Amazon rainforest, experts warned this week that because of drought and a 50% increase in logging over last year, the Amazon is on course for a severe fire season. And carbon dioxide levels measured at the Mauna Loa Observatory in Hawaii hit 418 parts per million in the atmosphere this month. That's the highest level in at least 3 million years.
I'm sorry. I'm still on the murder hornets. Continue.
A disturbing new study warns that because of man-made global warming, many densely populated parts of the world could be too hot for humans within the next 50 years. The researchers warn that unless governments act to transition away from fossil fuels, the world's habitable climate zone, in which humanity has thrived for 6,000 years, will shift so much by 2070 that 3 billion people will either have to move to cooler regions or adapt to extreme heat conditions. That shift will also bring water shortages, crop failures, and extreme heat waves that could trigger mass migrations. The biggest projected population growth is expected to be in regions that will see the greatest increase in dangerous heat.
Uncle.
Finally, some good news. Big Oil's Net Zero Club is getting bigger, at least in Europe. On Tuesday, the French multinational oil and gas giant Total said it is joining European oil companies Shell and BP in setting an ambitious target to reach net zero emissions by 2050. Now, critics note that all of these European oil majors' plans are vague, but the targets do signal a big shift in strategy for billions of dollars in capital investments, and would have been unheard of just a few years ago.
What kind of world is it when we have to turn to the oil companies for our good news? For much more on all of these stories and the ones we couldn't get to, believe it or not, check out our website at greennews.bradblog.com if you dare. Find, follow, and share us planet-wide on the Facebooks and the Twitters at Green News Report. I'm Brad Friedman.
And I'm Desi Doyen.
And this has been your Green News Report.
Welcome back to the Rick Smith Show. Now, here is Rick Smith.
So another shooting. I mean, it's really just crazy and insane to me. This one in Oklahoma City, Oklahoma. Evidently, people were upset they couldn't go eat in the dining room at McDonald's. Yeah, so they shot the person. I don't even know where to go with that. I mean, that's right up there with in Flint, Michigan, the person who shot the security guard because he asked the little girl to put on a mask and wouldn't let people into the store. It is literally insane to me. Which again is what we've seen over the last couple of weeks is just nuts. In fact, Kathleen sent me an email during the break saying, how do we make people care? She said she's so upset that she might have to return to work. She's terrified because of her underlying conditions. Plus, she writes, what about frontline workers? Why don't people care about them either? What is wrong with people? And that's the question of where we are. It's amazing to me. And here to share some thoughts on where we are, I've asked our good friend Dr. Kelly Sandholz to come talk with us. She's the co-founder of the MasksNow.org movement. Kelly, thanks for taking time for us.
Hello, good evening. I think the answer is we have had a problem for a very long time, and all of our underlying problems are being revealed. And one of the problems is we're really selfish people. In order for somebody to adopt the idea that I don't want to wear a mask, so I'm willing to kill you for it, there has to be a pre-existing selfishness there that, or you wouldn't be able to do that. It would be abhorrent to you.
Yeah, I mean, I can't even imagine. So you go, okay, I can't. I'll go get a mask. How hard is that?
And it's not just about it's also illogical. The fact that we know that 80% mask wearers or above will allow us to bring the level of infections down to below 1 per person, which is how you get rid of the virus. In other words, it's self-destructive and continually self-destructive to not want to wear masks.
No, I mean, and look, I've always been the kind of person, doctor, that says, if you want to do something stupid, you want to jump off a bridge, you want to do whatever it is you want to do, knock yourself out. You have the right in this country to be as stupid as you want to be. But the second that your stupidity, affects me, now we got a problem. And this is where their stupidity is affecting the rest of us, because I don't know if you saw the FEMA report, but they're saying they expect come June every day 200,000 people to get infected and 3,000 people to die. I mean, I don't know how much clearer you can be that once we open up the doors, things are going to get a lot worse and real quick.
Probably going on almost 2 months ago, we talked about how the world is going to be before the virus and after the virus in our country. And you're so right. One of the very concerning things that is hitting now, scientists are saying this could get, quote, out of control. And what that means is that it could get spreading so quickly and so ferociously that it could take down our hospital system. It could overwhelm every kind of defense we have. It could absolutely crush our economy. Like those numbers you just described, if you think through what the world would look like in that situation, it's utter devastation with no ability to react to it anymore. Because once the virus is on a roll, we won't be able to stop it.
Yeah. No, I mean, Bill sent me an email earlier today who said, he said, look, China shut down for 12 weeks. They delivered food to people. They delivered doctors to their houses. They weren't allowed out of their house for 12 weeks. They shut things down. That's how they got rid of it. And we've kind of done that. Some of us have stayed home, but still people are venturing out. And now you've got these knuckleheads saying, no, we just need to swing the doors up because I need my hair cut. I need to get my roots colored.
Everybody needs their hair cut. Yeah, I know. But remember back a couple of years, even 20 years ago, there were these man on the street videos, where you could listen to somebody try to talk about geography or history and they were idiots. We all thought that was so funny, and that really is at the core of what's wrong right now. Everybody thought it was funny, but nobody did anything about it. We've got a right to be stupid, and cheered them on, I guess.
No, and there's almost some kind of some kind of status to being dumb. I remember kids, and look, I may have been one of them. I may have been a knucklehead too when I was in school, going, what am I going to need this for? What am I going to need science or math for? I'm now finding out why I needed both.
Mm-hmm. And also the underlying racism and misogyny that drove that also. All of this is coming to roost. When in the 2008 downturn, a lot of our housing issues came to the surface, things that were being hidden by refinances. The fact that a large proportion of our population were living on periodically refinancing their house, and when that stopped, the entire economy couldn't take it. We're now seeing all the problems, racism, the way we handle our money, who we decide gets help, how we funnel the money to the oligarchy, like all of these problems that have been ongoing but kind of hidden because everybody was doing good enough, they're all going to come to the surface, and it is going to get worse. I mean, we're really just at the beginning of this. And my biggest fear is the healthcare system. I really think that the protection of that is so important. A doctor today wrote an essay about how, when this initial rush of the pandemic is done, she's quitting. And I just fear we're going to have an avalanche of doctors who say, I just simply can't do this anymore every day. I can't keep this up. My family's falling apart. My finances are falling apart. I'm worried that if we hit that 3,000 number, our hospitals, our medical clinics could really collapse.
Yeah,
and
no, you're right, and not just doctors. I'm worried about. I'm worried more about nurses. I'm worried about all of the people who work in our healthcare system leaving.
Everybody, and the nurses. I mean, they're on night shift. They're on day shift. It's bad enough to have shift changes on your bodies, but when you have the stress and emotional upheaval every day of watching people die, and then turning on the TV and seeing people making it happen more, it feels like you're pressing against something you're never going to be able to fix it. The nurses are really hurting bad, and they need help.
Yeah, I mean, this is one of these things that is I almost can't express how I feel about some of these folks who do these really dumb things without thinking about anyone else. And you're right, when you said, it's highlighting the fact that we're really a selfish society.
They have found a level of glee in their selfishness that is unmatched. I mean, when you watch on the things that trend on Twitter, you'll see some of the most vicious things. There's a conspiracy movie out right now they're very excited about. Well, they use scientific words that these Trump followers don't understand, so they can't tell it's not true. And they're just very excited about it. They're very punitive, very damaging with their words, and they don't know what they're talking about. Yeah. It's just really hard.
So let me ask you this, because I think we've already seen the pivot by the Trump administration away from worrying about how many people are sick and how many people are dying. I think we're pivoting now to they've already signaled that they're going to stop really trying to test everyone. That they're now going to start questioning the number of people who have died. They've already begun that process. And now all of the statistics, all of the facts that I think Fauci and the CDC or anybody else is going to come out with will be attacked as fake news. How do people deal with that, do you think?
I mean, my feeling on it is that I'm not sure we can last months and months with this. Like, they're ratcheting it up. There does not appear to be any end to the level of disgust they will go to. And so they're just like, their only thing is we have to win. And they're turning it all the way up. And there are enough people that don't understand science. They don't understand kindness that will follow them all the way. I will say this, though. A lot of people want to stay home. They understand that this is not good to be going out and trying to work and be exposed to people and bringing home to grandma.
Right.
A lot of people want to stay home, but they think we don't have enough money to do that, which we do.
I argue we don't have enough money not to. I mean, if things get the way even FEMA is saying possible, the healthcare spending alone will be just astronomical.
Well, for one thing, it may bring down the for-profit healthcare system and cause a transition to a single-payer system rather rapidly, because if all the hospitals go out of business, who is going to take care of people? And, I think people can't see that far ahead. They can't realize that's really what could happen. I don't know if you knew this, but a lot of doctors are now on furlough. They've had their salaries cut 20%, most of them 50%.
Yeah.
Now, think about that. You have your salary cut 50% with no warning indefinitely. And the hospitals just don't have any money. They do not have any money. And if we're hit with a 3,000 death rate a day, I could really see some major hospital failures.
Boy, I look, there's part of me that wants to see the hospital, the system as it is broken and in collapse, but I don't want to see the number of people dead and the death and destruction that would come because of that. I actually don't even want to think about it, to be honest with you.
It would be nice if we could do the transition in an intelligent and kind and sensible way, but we seem determined to do it in a crisis mode kind of way.
Yeah, it's the only time we do anything as in crisis.
Apparently.
To steal a Winston Churchill quote, Americans always do the right thing after trying everything else first.
Well, I had a very, very good friend seriously injured today, and I was thinking about the doctor taking care of him and the nurses and the people interfacing with his wife, and they're just so amazing. And with the loss of one of those teams is hundreds of years of intelligence and experience down the drain. And if you picture that times thousands, it would be a great irreplaceable loss. That's the problem with a lot of what Trump is doing, is a lot of the danger and he's inflicting on this nation is not things you can just turn back on or fix or just buy a new one. There are things that we've taken 100 years to build.
Yeah, I mean, he in one term, we've gone from the most powerful country in the nation to possibly rubble. I mean, if this gets as bad as the math looks like it's possible, we could see, the worst predictions, which were 2.5 million dead, half the country infected. We could see mass economic chaos. But hey, at least we'll have opened the economy early.
At least we won't have to wear a mask.
Yeah. Scary stuff. Let's hit that real quick. Masksnow.org. How are we doing? You got enough people? How can we help?
Okay, big help. I need help today, right away, in the next 2 days. Get all the nurses, doctors, nursing assistants, anybody who works in hospitals, administrators. We've got a letter on the website that I need people to sign. If you have trouble finding it, just find me on Twitter. It's at MountainMD, MTNMD. And we really need everybody to sign this. We're working on pushing for mandatory mask usage in companies and in communities and states all over the country so that we can get this virus under control. That is one of the 3 critical pieces we're going to need, and nobody's working on it. So we are, and please, put the word out to nurses, anybody you know, have them contact me, and we'll get them hooked up with the letter.
Good stuff. And also text message 50409. Send that text out, and you'll get information on how you can help out to make masks, to help ease the need, and, do something while we're sitting at home.
Oh, my God. Yeah.
But Dr. Senholz, I appreciate the time, the information. Thank you so much, as always.
All right. Take care.
Thank you again. Pretty simple. Message 50409, and they will send you some information on how you can get more information. Gonna take a quick break. Right back. Stick around. Listen to the Rick Smith Show.
Saving work in America, one show at a time. The Rick Smith Show.
I'm Rick Smith, and this is Labor History in 2. On this day in labor history, the year was 1907. That was the day known in the San Francisco labor movement as Bloody Tuesday. In the early 20th century, San Francisco was a city with a strong union movement. In early May, the Carmen's Union called a strike against United Railroads, the company that ran the city's transit system. 1,500 carmen walked off the job, demanding an 8-hour workday and a $3 per day wage. The strike began on a Sunday. The city's transit lines stood silent. The next day, tensions began to mount. The company put up barbed wire around the car barns. Strikers believed this was in preparation to get the streetcars back up and running. Strikers and supporters gathered around the car barns. The day passed with nothing happening. But the next morning, as picketers gathered, 6 cars rolled out of the barns. Hired guns rode with the scab drivers. Angry picketers attempted to stop the streetcars, bombarding them with bricks and stones. Gunfire erupted between the armed company guards and the picketers. 2 picketers were killed in the hail of gunfire. Many more were injured. But this bloody day was not the end of the injuries. It's estimated that 24 people were killed in accidents while scab drivers operated the streetcars. Strikes by public transportation workers were often some of the most contested work actions to take place in big cities. These workers had the ability to impact work sites far beyond their own, since they transported laborers to work. The magnitude of a transportation strike would ripple throughout a city, and these strikes were often met with fierce resistance. Labor History in 2 brought to you by the Illinois Labor History Society and The Rick Smith Show. For more information, go to laborhistoryin2.com.
Welcome back to the Rick Smith Show. Now, here is Rick Smith.
So evidently, the Trump administration's figuring out how they're going to mine on the moon. They didn't save mining here in the U.S., so now they're looking for ways to mine the moon. And again, it's nice that they've got great plans for Space Force and living out all of those fantasies that he had when he was a kid, and look at giving corporate America, the rights to the moon. If we find something up there, corporate America is going to be really thrilled that they're going to be able to profit from it and make as much money as they possibly can. But evidently, they're developing legal plans to begin mining there on the moon, and they're going to create bases with a number of U.S. allies, evidently. That's according to Reuters. So yay, we're going to start destroying the moon. As if it didn't have enough craters. We're going to just add a bunch more. Also, the IRS, everyone's favorite IRS, they are demanding that dead people return their checks. I don't know where else to go with that. If you're dead and you got a check, please return it. Now, obviously, if it goes into an estate, obviously you cannot, like Social Security, you cannot keep it. You've got to give it back. So that's what they're doing. That's what they're pushing for. Also today, and finally, remember Bridgegate? Remember how during the Chris Christie administration in New Jersey, you had a couple of people who decided it would be a good idea. This Bridget Kelly and this Bill Baroni, who thought it'd be a great idea to close one of the exit. I think it was Route 4 there in Jersey, right before the Fort Lee exit. right before the George Washington Bridge, which just made it an absolute nightmare. Well, the Supreme Court threw their convictions out because they said that, well, they didn't make any money off of it. I said at the time it was a dumb idea to convict them. I said what they should have done is taken them to the nearest truck stop and dropped them off. If they'd have gotten out, they could have gotten away. But there you go. Anyway, if you missed any of today's program, thericksmithshow.com, that's where you go to get the podcast, the Rick Smith Show app on the smartphone. Thanks so much for tuning in. We'll see you back here next time.
You've been listening to The Rick Smith Show. Email Rick at rick@thericksmithshow.com. Until next time, this has been The Rick Smith Show, where working people come to talk.